Hair loss and its treatments. Miss Kirby class, student made and led. One thing I will address is we cannot talk about hair loss and the treatments without talking about the growth phase of the hair and the two types of hair that is on the body and the head. Growth cycles of the hair. The three phases of the growth cycle. A way to remember this is using the word ACT, A-C-T, in the order that the hair goes through the cycle. Anagen is also known as the growth stage. During this phase, the hair cells are produced faster than any normal cell on the body. A healthy scalp hair is able to grow a ½ inch per month. The hair grows faster at the ages of 15 to 30, but slows down sharply at the age of 50. The hair spends about 90% of its time in the anagen phase, and it can last anywhere from 3 to 5 years. In some cases, it can go as long as 10 years. Second phase is your canagen stage. Your canagen stage, during this canagen phase, the follicle canal shrinks and detaches from the dermal pili. Again, the follicle canal shrinks and it detaches from the dermal pili. Less than 1% of the scalp hair is in canagen phase and lasts between 1 to 2 weeks. It can last 1 to 2 weeks. The last and final stage, which is your telogen stage, also known as your resting phase. It is the final phase. It lasts until the hair fully grows the hair and it sheds. Less than 10% of the hair is in telogen and lasts up to 6 months. Bellis hair is also known as Lango hair. Bellis hair is also known as Lango hair. It is short, fine, unpigmented, and downy hair that appears on the body. Bellis hair never has a medulla. Bellis hair never has a medulla. It is commonly found on infants and can be presented on children until puberty. Remember, Bellis hair is found on infants and is also known as peach fuzz. Now we're going to talk about your terminal hair. Your terminal hair, it is your hair that is long, coarse, is pigmented, is found on the scalp, the legs, the arms, and the body of males and females. The terminal hair is coarser than Bellis hair, and with the exception of gray hair, it is pigmented, and it usually has a medulla. Now we're going to get into hair loss. Hair loss is a natural result of anagen, canagen, and telogen phase, which is the growth phase that we just previously talked about. It provides the growth, fall, and replacement of the hair strand. Abnormal hair loss is called alopecia. It is found in both men and women. Androgenic alopecia. It is characterized by maturation of terminal hair that is converted into vellus hair. The results from age, genetics, and hormonal changes. Male pattern baldness is progressed, familiar, is in the horseshoe shape. So keep this in mind. The androgenic alopecia is also known as male pattern baldness. It's also known as male pattern baldness, and it is shaped in the horseshoe shape. Now we're going to talk about alopecia areata. It is the autoimmune disorder that causes the hair follicles to attack by its own immune system. The white blood cells stop the hair growth in the anagen phase. So an easy way to remember this is androgenic alopecia, android, your loops for the horseshoe, alopecia areata. Remember, areata is area within your own area, your immune system. Now you have alopecia totalis. Alopecia totalis begins with one or more bald patches, and then it goes in total scalp hair loss. Then you have postpartum alopecia, which is temporary hair loss at the end of the pregnancy, and then it'll return back to its normal growth cycle within the year of delivery. Alopecia universalis means complete body hair loss. Notice the lady in the picture have no hair on her eyebrows, anywhere, head and all. Total body loss, legs, everything. The treatments there are two treatments. You have a treatment that is topical, that is minoxidil or doxil, that is put on the scalp twice a day, proven to stimulate the hair growth. Both men and women can use it, and it's sold over the counter into two different strengths. Your second treatment is your thin, a straight. It is oral and only the medicine that can be taken by men. It does slow the rate of the hair loss. It is have side effects. It could have weight loss, weight gain, sexual loss of the functions. Another treatment that can be done. It is also you could do what's called hair transplants, where they remove small patches, sections of your hair, and they place it on the bald spots. Or my favorite, wigs, hair extensions, hair weaves are also other options. This concludes the principles of hair loss and the treatments. And remember, we cannot talk about hair loss and treatments without talking about the act of the growth cycle, anagen, canagen, and telogen. Again, this is Miss Kirby, and these are student made and led.